Before we begin, just the rules of the game. Today is the first live class. Day 1, we are going to discuss all the infertility MCQs. When we say infertility, it's a huge topic. All these what I'm discussing, my dear students, are MVP MCQs. By MVP, I mean the most important previous year question and also Virgin MCQ. Virgin MCQ is my terminology, my specialty. It simply means brand new MCQ. So throughout the lecture, if I use the word Virgin MCQ, please don't get confused कि अरे सर ये Virgin MCQ क्या बोल रहे हैं. Okay, so Virgin MCQ means brand new MCQs. At any given point of time, if you don't understand anything, the chat box is available and you can ask me your doubts. Okay, now when the question will come in front of you, I want all of you to participate. Right, wrong does not matter. We are all here to learn from the mistake. So better to make a mistake over here than to make in the exam. Is this understood to all of you? Yes, can I get a thumbs up so that can we begin? Okay, and today is day 1 of the infertility. The whole schedule is live. The timing is the same at 9 p.m. So every day 9 p.m. to 10:30 p.m. is the agenda. 90 minutes fun time. OG in the chat box and we begin. Okay, so now first I'll put a series of multiple questions and let us see. Question number 1. This is a PYQ. Diagnosis in the chat box. Answer in the chat box. 25. Clinical case. Directly to begin with, we are going with a clinical case. Obese female patient. Hirsutism, oligomenorrhea, anxious to conceive. Which of the following is not helpful in the management of this patient? Chalo, exactly 10 seconds time. All of you. A, B, B, yes. Okay. So please, right, wrong does not matter. I want all of you. Excellent. A, B, C, D. Okay. Yes. Okay. Yes. So now please pay attention. We come back to this question in a minute. First, एक साथ 4 solve करेंगे. Okay. Moving on. Yes. So don't worry. Picture अभी बाकी है मेरे दोस्त. Next MCQ is this. 28-year-old married lady, PCOS, infertility, partner investigations, normal. The treatment of choice for her is. Second question. Yes. Ovulation index, letrozole, clomiphene, HMG, ocipils. These are all I'm showing you how the questions will be twisted, how the questions will be turned so that you get a complete idea, and then I will go in for the explanation, detailed explanation. Don't worry, coming. Okay, many of you are saying A, B, C, D. Okay. Don't worry. One more. Okay. One more MCQ. I'll give you 10 seconds time. 27-year-old married lady, married hai, obesity, irregular periods. I want the diagnosis in the chat box. LH15, FSH5. Patient is anxious to conceive. Most appropriate management in her condition. Okay. So, ek saath, and then when you listen to the explanation, you'll be blown away and you'll come to know all this. Chalo. A, B, C, D. Yes, Yuvraj, very good. Yes, Tara. Yes. Okay. A, C, A, B, C, D. Okay. Yes. So now, okay. And one more, but don't worry. So, एक साथ पहले 5 questions discuss कर रहे हैं. So even those who are joining in late can enjoy the session when they come back in, when they're joining in late. And now, one more MCQ. Okay. And then I give all 5. 17-year-old girl, irregular periods, increased hair, acne, USG, bulky, ovary size. Sir, is the size important? Yes, size does matter. Okay, at many places in life, size does matter. Okay, 15 ml, 20 ml, this significance also I will tell you, which is not used as a treatment. Okay, yes, Subhasini, yes, D, weight reduction, ocipil, Zenit D. Okay, yes. And the last question, all of you, before I proceed to all the explanations. Okay, again, 20-year-old girl, treatment for hirsutism, obese, acne, irregular periods, testosterone mildly elevated. Which of the following is the most appropriate? C, A, C, C. Okay. Chalo, student. Thank you. Okay, so all of you, and now let us see all together, all of you. So see how and what we are going to decipher. Now, all of you, what is the Rotterdam criteria? Only the student who attend my lecture or read my book will get this correct. Anybody? What are the Rotterdam criteria? Kabhi suna hai? And in Rotterdam criteria, why is it important for me to know the Rotterdam criteria? Okay, so please understand student, Rotterdam, totally there are 3 criterias. Rotterdam criteria is for diagnosis of PCOS. Rotterdam is a place in Europe near Amsterdam, where way back in the year 2003 the meeting took place. The European Society met, the American Society met. As usual, Indians were not invited because we either follow the British guidelines or the American guidelines. And then they said, these are the criteria. Criteria number 1, an ovulation. An ovulation. Okay, this I can come to know clinically if the patient has got irregular periods. Okay, an ovulation, or if I document on ultrasonography. Second is hyperandrogenism. Okay, this hyperandrogenism could be biochemical or clinical. Biochemical means if I do the blood test, the testosterone is going to be elevated. And clinical means when I look at the patient, acne, oily skin, hirsutism, facial hair, acne and hirsutism. And third is the ultrasonography criteria. Anybody, what is the famous description picture? Also I will show you image based questions also we are going to discuss. Stay right till the very end. Okay, in the ultrasonography we get this multiple small follicles arranged in the periphery, called as the popular the necklace of pearl pattern. Okay, necklace of pearl pattern. Anybody, what is the criteria for the follicles? Anybody, what is the criteria? Yes, necklace of pearl pattern. Shiv Kumar, the 20 follicle is new criteria. Very good. When I use transvaginal as per Rotterdam, what criteria? And this. Okay, I'll also tell you the recent advance. Okay, so here for normally when we are doing a normal sonography, yes, 12 or more than 12 follicles. Anybody, size of the follicle? Yeah, size of the follicle. Anybody, what is the size? Yes, very good. Yes, very good. So these are chote 2 to 9 millimeter in size small follicles. 2 to 9 millimeter small follicles. Okay, all the follicles are arranged in the periphery in the ovary, typically necklace of pearl pattern. Now, can anybody tell me, if we are not able to measure the follicle, if we are not able to measure the follicle, then we go with ovarian volume. Anybody, what is the criteria for ovarian volume for PCOS diagnosis on USG? If yes, ovarian volume more than 10 cc or 10 ml, and even one ovary is absolutely fine. Is it understood to all of you, my dear students? So you have learned very important thing, and now is the most important part. Please pay attention. I'm explaining all the MCQs, don't worry. Understand this, that for as per the Rotterdam criteria, any 2 out of 3 should be present. Okay, dear students, any 2 out of 3 should be present to make the diagnosis. That means any 2, either an ovulation, hyperandrogenism, ultrasonography, any 2 out of 3 should be present to make the diagnosis. Is this understood to all of you? Can I get a thumbs up? All the 3 can also be present, but any 2 out of 3 is more than enough. So now if I ask you, tell me true or false. ध्यान से सुनेंगे. One more bonus MCQ. If I tell you true or false, I write, in a patient of PCOS, ultrasonography can be normal. True or false? Chalo, in the chat box, all of you. Excellent, all of you. Clap for yourself. Yes, sir. Because, sir, any 2 out, even if criteria number 1 and 2 are present. So please understand this, my dear student. Absolutely, this is a true statement. So what is the logic? Yes, sir. And sir, this necklace of pearl pattern, or what we call a string of pearls, is present in 65 to 70% patients only of PCOS. You don't have to remember the numbers, but in 30% patients, in 25 to 30% patients, the ultrasonography can be normal. So remember this difficult MCQ if they ask you that, sir, in PCOS, the sonography, ultrasonography is normal. Yes. What is the most common pattern seen? Necklace of pearl is the most common pattern seen, but ultrasonography can also be normal. Now please pay attention, the most important of the whole session. in PCOS. Anybody, please understand, there is nothing like drug of choice for PCOS. PCOS always, the treatment will depend on what the patient wants, what the patient desires. Patient could come to us with infertility. Okay, they will either tell you patient is infertile, planning to conceive, anxious to conceive. Everybody's anxious. All of you are anxious to get a PG seat. Okay, so anxious to conceive. Now, anybody, one word answer. One word answer. Why is there infertility? Infertility is there. Why? Why is there infertility? Yes, Dipti, Pranav, all of you, super, excellent, all of you, sir. It is because of an ovulation. So what am I supposed to do? What am I supposed to do to make her fertile? Sir, whenever the patient is either infertile or they say she is planning pregnancy, then sir, because there is an ovulation, I have to go for ovulation induction medicines. And my dear students, clomiphene citrate was the first drug of choice for ovulation induction. So many years. So if you were giving the exam pre-COVID, अगर आपने एग्जाम होता 2016, 17, 18, your answer would have been clomiphene. But now in 2019, and therefore this MCQ surely is coming in the upcoming examination. In 2019, a meeting took place, very big society, everybody, Indians, Americans, Europeans, everybody met, and they said that sir, letrozole is giving better pregnancy rates. Details you don't have to remember, but letrozole, yes, is a monofollicular growth. Letrozole, more chance, because see, finally we want baby, so more success of ovulation induction, more live birth rate. Yes, no, beta Samriddhi, clomiphene very rarely causes OHSS. Okay, clomiphene will very rarely cause OHSS. That's not the reason. Letrozole has better outcome, mainly better pregnancy rates or better success rates and better more live birth rate, and therefore letrozole, my dear student, all of you will remember, is the first drug of choice. In case if the patient may not respond to letrozole, even clomiphene citrate of course can be used. And both these are oral medicines. Okay, both these are oral tablets. If this also does not work, then what do I do? Anybody, if this oral medicines don't work, I have to go for more powerful medicine. Which is that? Anybody? Yes, coming to that. Okay, coming to that. Okay, so now all of you please pay attention. Now we are able to answer few of the MCQs which we had discussed, and then coming back. Okay, yes. So anybody, ये MCQ का आंसर क्या है? Married lady है, PCOS already diagnosis given to you, husband is normal, clomiphene citrate ovulation induction was the old answer. OC pills will not work. Why? I will tell you in a minute. Answer to this, ovulation induction with letrozole. Clap those who have got it correct. Okay, so I discuss, I'm coming back. Okay, so turn by turn all answers I will give you. Okay, ovulation induction with clomiphene is the answer to this MCQ. Okay, what is C? I will tell you in a minute. Anybody, now what is this HMG? Human menopausal gonadotropin. Those who are hearing me for the first time, note it down. The full form, human menopausal gonadotropin. Okay, this is, how do we get it? Please understand this. And for this, I'll explain to you master servant, and sometime it will become crystal clear. Whenever there is menopause, ध्यान से सुनेंगे all of you. Pituitary is the master, ovary is the servant. Pituitary is the master, ovary is the servant. So if your servant is not working at your home also, if your servant is not working, what will you do? You will shout at the servant, right? Hey, kaam karo, kaam karo, kaam karo. Yes or no? Your parents will shout. Okay, you work, work, work. A day will come when the servant will say, sir, bhaad mein jao. Enough. Now I'm stopping my work permanently. And at that time, your parents or the master will shout very, very loudly. What am I saying is, as the ovarian function will decline. And this also we're going to discuss at the end of the class towards marker for ovarian reserve. MCQ is coming in sometime. Okay, so all postmenopausal lady, the FSH is very, very high because the ovarian function has stopped completely functioning. So FSH is very, very high, and in the blood FSH is high. So blood में से फिर urine also FSH is very high. So menopausal lady, we take urine directly, urine को body में inject नहीं करते हैं. Okay, but from the urinary source we get this HMG from the urine of the postmenopausal lady. Is this understood to all of you? From the urine of the postmenopausal lady we get this HMG. This is an injection. So all you girls, you can do some social service. Whenever you reach menopause, you can go and donate urine, and from that urine we will get HMG. So in pathology class, teacher tells you, sir, donate blood. Gynec teacher is telling you donate urine. Your urine can give somebody new life. Okay, so HMG is human menopausal gonadotropin, or recombinant FSH is also available, because finally I want the follicles to grow. FSH, follicle stimulating hormone. So recombinant FSH or HMG, human menopausal gonadotropin, both are similar. This is artificial source. This is human source from the urine, and these are costly injections, and they are the last resort when both these oral medicines fail. Virgin MCQ agar aayega. Okay, thank you Arnav, thank you. I'm just an ordinary teacher trying to make things easy for all of you. Okay, please don't give me God. Yes, but okay, so dhyan se suno. So now Virgin MCQ, Virgin MCQ क्या है कि सर, I have got a patient who is PCOS, who is infertility, and now letrozole given, letrozole no response, clomiphene citrate given, no response. Now what will you go for? Anybody? Now what is the answer? Anybody? PCOS patient, infertility, letrozole not working, clomiphene not working. Now what will I do? Drilling ke pehle beta, drilling last. Soumyadeep, drilling is kachra. Yes, Tanya, now is the time, sir. I will give recombinant FSH or HMG when the patient of PCOS, infertility, resistant. If she is resistant to oral ovulation induction, next line of management, recombinant FSH or HM. Thumbs up if you understood this. Drilling uske baad, last one, drilling I'll tell you when. Okay, is this understood to all of you? So this is the whole flow chart for all of you in one line. Is this understood to all of you? So now you know this also. So now this was the first question of our day. Patient is hirsutism, oligomenorrhea, anxious to conceive, so we know it is PCOS. Which of the following is not helpful? Not helpful. Letrozole of course can be given, clomiphene of course can be given, and all of you know metformin is a insulin sensitizer. Patients of PCOS have got insulin resistance, and metformin will tackle insulin resistance, and therefore also it is very, very important, and therefore OC pills is the answer. Why? Because please understand this, okay, if for a infertile patient is infertile, correct? Patient is infertile, anxious to conceive matlab she wants pregnancy, patient wants pregnancy, okay, and to a lady who wants pregnancy you will give birth control pill. Patient bolega ye doctor pagal hai, yes or no? Yes. So OCPIL has a role. Yes, very good. Okay, OCPIL has a role in PCOS. Absolutely. कब देना है picture अभी बाकी है मेरे दोस्त, 5 minutes के बाद. So first MCQ of the day, what we discussed, answer option number 8. Is it crystal clear? Hashtag crystal clear in the chat box. My only purpose of this lecture is to make OBGY your most scoring subject and give you hashtag crystal clear concept. That's my only two target for the whole till your PG seat. OBGY will become your most scoring subject. my guarantee, and you will get crystal clear concepts. First MCQ, ocipil is the answer. Moving on quickly, next MCQ kya hai? First choice, yes, letrozole is the answer. If not clomiphene, if not HMG, again ocipil is not for planning pregnancy. Second MCQ bhi ho gaya. Year,